Hello, my name is Joseph Felker. I'm a small general contractor in the Flathead Valley. I'm also a service-connected disabled veteran. I've had some experiences over the last couple of years that I'd like to make people aware of with the VA system and with private health care. I've been on pain medication since the mid-90s. During that time, I've been on a drug most of the time called tramadol. My pain had gotten to a point where it had gotten worse, and the VA had also put me on some hydrocodone. Some time went by, and I was using those as needed, and some time went by when the VA contacted me and said that they could no longer prescribe 2 controlled substances at one time once they elevated the tramadol to a controlled substance. So then at that time they told me that they had to take away one of the drugs. Now the hydrocodone is much more of, I guess, a potentially addicting drug, and it's much higher on the level of opiates than the tramadol is. So I was given an option to get much more of the hydrocodone or stay on the tramadol. And I didn't want to step totally into the higher doses of the opioids, so I stayed with the tramadol. It went on that way for, a couple of 3 years again, and then one day my VA doctor, the nurse called me and said that they were changing my medications. And I asked why, and she says, well, it was just a procedure they were going through. And at that time, this doctor who was in charge of my file at the time, or my health care, was a stand-in for my primary care doctor who was out on leave. They prescribed me some non-opioid prescriptions, and I told them I'd give them a try. I did. They did really no good whatsoever. There was no effect. Also, the adverse effects on them were quite troubling to me, because they were that one of the main symptoms that you could experience was clumsiness and dizziness. I'm a carpenter. I climb scaffolding. I climb ladders. Okay, I couldn't, put myself in that situation. Anyways, I asked them if they would put me back on the hydrocodone and the tramadol, and they said no. First off, I'd like to say that the VA, they're all very compassionate, well-educated people. I'm certain the people I was dealing with at the clinic weren't as happy as I was about this, or were as unhappy as I was about this. But it just came as policy down from somewhere up above that this is what was going to happen. That's basically a violation of my first baseman's Bill of Rights, which is to be involved in my own health care. They took away my ability to do that, and basically left me no choice but to do what they were telling me to do. I ended up at that time going to a private physician and explaining the circumstances to her. And we agreed that considering I have a serious neurological disorder, I have degenerative disc disease, I have peripheral neuropathy. I've seen one of the best neurosurgeons in the valley. He has studied my nerve induction test and my MRIs, and said that to operate on me at this time wasn't a real good idea. It was such a complicated operation that he could cause more damage than good. And basically told me to try to tolerate the pain, and once I couldn't tolerate the pain anymore, that then I could opt to get an operation. So I'm in a position, in order to stay working, I need these medications. There is no way without my physical therapy, my chiropractor, or these medications that I would possibly be working. I couldn't see myself any longer, at least trying to avoid these medications. They've helped me work. Without them, I won't be working. In turn, too, it would hurt the employment of a couple of my employees. I also have subcontractors that work for me. I'm certain they'd be able to find other work, but it would sure hurt them, too, if I had to shut down my company. I enjoy working. I've basically tried every avenue to do the pain reduction that I can. I see a chiropractor once a week. I go to physical therapy, which will be ending soon, but I've been given the tools that I need. My physical therapist and my chiropractor both agree that, you know, I have no alternative but to take, you know, some type of pain medication in order to keep functioning. I'm certain that if I was taken off of these medications, and the veterans that I know are taken off these medications to where they can't work, or if I couldn't work, I would have no choice but to request 100% disability from the VA, because I am service connected in my disability, and the VA would have to put me on the disability. I would also go and collect my Social Security earlier than what I anticipated, just in order to survive, pay the bills. I have no idea how many veterans would be in that position, but there's got to be tens of thousands, if not hundreds of thousands nationwide, that would have no other choice but to go on this disability. The unforeseen consequences of taking away these medications could cost phenomenal sums of money, including in the private sector. You take it away from people that are not covered under the VA system, they're in the private system, but they'll go and collect their SDI and any other federal, state, and local assistance they can get. I don't know if people have really considered, the ones that are going to legislate this, what the actual costs are going to be, or some of these unintended consequences to these families. At least my children are raised. My wife and I would probably be able to get by on a fixed income. But what about some of these guys that are younger that are raising children? People thought about them when they can't work anymore? I've also heard that there's a lot of these street drugs that are around, like this, I believe it's called fentanyl, that these people out on the streets are getting, and it's like 10 times more powerful than the heroin they're used to. I was hearing that, I think it was in Ohio, that they had just this epidemic of overdoses because of these street drugs. And I do believe, you know, of course, we've got to try to do something about the street drugs. We've got to do something about the bad players that are there, you know, with these prescription drugs. But if you're putting the prescription drugs in the same light as the hard narcotics that there are, and grouping in those amount of overdoses with the overdoses with the street drugs, that's completely wrong. It should be looked at in its own separate light, because it's two separate situations. If they take away these drugs, they are going to increase the amount of people that are going to the streets for these drugs. And then they're addicted.